I'm Mary Beth Shepard with OraSure's Story from the Field program, and today I'm here with Ralph Belois from St. Barnabas Hospital in the Bronx. We're here today to talk to him about his innovative and successful routine HIV testing program. How you doing today?
I'm good. How are you?
Great. So the first thing we want to talk about is, can you tell us why the hospital decided to start a program like this?
Well, if you look at the Bronx, we're the epicenter of the epidemic in the country. In our zip code, there are 3 out of every 100 people who are known to be living with HIV. And we also know that about 20% of those people don't know that they're living with HIV. So it makes a lot of sense to do an expanded rapid testing program in an area of such high need.
Excellent. And so what is the goal of the program?
Well, the goal of the rapid testing program is to test as many people as possible. We're really trying to target every single patient or person who uses our facilities between the ages of 18 and 64 to at least get their HIV status on their record.
Excellent. So why don't you tell us a little bit about the actual program? How are you doing the testing? Where are you doing the testing? What kind of method are you using?
We use streamlined testing and we use rapid testing. So the counselors focus their attention on getting to as many patients as possible. So we expand to the emergency room, the inpatient units, 2 clinics in our building, and we also actually do 2 clinics at Union Community Health Center. We do a streamlined approach in the fact that we just hand people information about the test, which is the Part A of the New York State consent form. And if they have questions, we answer them, and then we move on to having them sign the consent, and we just do the rapid oral test. We wait the 20 minutes, and we give them their results.
So what has the patient reaction been? Are they open to it?
I think the patients actually love the oral test. It's much more accepted than the finger stick method. So we've taken that barrier of people being fearful of the finger stick and said that, look, you're just going to put this in your mouth. You're going to it's harmless. It takes 20 minutes, and you'll be able to walk away in 20 minutes knowing your status.
So how many people have you been able to test and connect to care?
In 2009, all total, the hospital tested 13,397 unique clients. My program did 12,484 rapid tests. We identified 57 new positives for 2009, and I believe about 70% of them are actually already linked to care.
That's excellent. So what do you think are the factors to your success?
I think that what really works is that, number one, we have tremendous buy-in from the administration. They've supported us right from the get-go. It's something that they really want to have done, and so they've given us the tools that we need to get it done. We have staff that are truly committed to it. And I also think that what we've done is we've moved the service to the patient. So in the inpatient units and in the ED, our counselors use carts, and they take the carts around with them, and they have all their materials on the carts, and they can go from room to room, bed to bed, cot to cot. And because we do the streamlined approach, we're not wasting resources on doing the pre-test counseling. We're putting our resources where they need to be. Test as many people as possible, find the ones who are positive, and then spend the time you need to spend with them on giving them the post-test counseling session, giving them tips on how to, not to transmit the disease to anybody else, and then to link them to care. And that's really where we've been successful because, like I said, we've linked about 70% of the people we've tested, found positive, we've linked them to care.
So what advice would you have for other hospitals who are looking to implement an HIV routine testing program?
Well, I think the best thing to do is to say where you're going to put your resources and put your resources where they're needed. Also, the advice is that our program doesn't get in anybody's way. We don't inconvenience the nurses or the doctors. Yes, we do ask a doctor to draw the blood for an inpatient who has a reactive test, but other than that, we're in nobody's way. Our carts are not in anybody's way. Our counselors are not in anybody's way. And our counseling team has been accepted by the hospital. They're actually known as the Dream Team. And so everybody knows our counselors. They know what they're there for. And the reality is to take those tools that will allow you to bring the service to where the service needs to be and just run with it. And then the other trick is to really make sure that administration is involved. And like I said, one of the things about St. Barnabas is administration has been involved in this right from the very beginning, to the point that it is always on their radar. Our publication department releases the information that we give about the number of people we test. We do a lot of testing events, and every time we do a blast to the entire hospital saying, did you know this? And we talk about the epidemic in the Bronx, in New York City in general, and to the point where it really is on everybody's radar, so much that on this Monday, we actually are starting to do routine rapid testing in the dental chairs as a pilot in our dental program here on the main campus.
That's excellent. Is there anything else you wanted to share with us today, Ralph?
No, other than the fact that it's a project that works. We are part of the Bronx Nose Testing Initiative, which in the first year we tested 160,000 people as a borough, and I understand that the second year numbers are going to just knock the socks off of everybody when we finally get them out there, and it just makes a lot of sense. It's not that difficult to know your HIV status these days, and it's really quite important.
Thank you so much for taking the time to talk with us.
You're welcome.